Okay. So we have Sarah Geisler. She is our fearless trainer today. She's been working with members and in this industry for decades. Like she came from a single entry point doing nursing facility assessments and just has a wealth of experience. And so she is an in-reach coordinator with the Office of Community Living here at Healthcare Policy and Financing. We have Victoria Lewis, who is also really amazing to work with. Um, and Victoria Lewis is also an in-reach coordinator with the Office of Community Living. They are both your subject matter experts that will be here to, Sarah's going to present the training, but also answer questions, and Victoria will also be answering your Q&A questions. So don't forget, we have our Q&A open, so please do submit your questions Q&A via the Q&A, and we will get those. She'll be working on answering those. Um, and then we also have Brianna Grunke. You probably have seen her before because I know you live and breathe care and case management system. And Brianna is one of our amazing trainers at AssureCare. So she is also here. She'll be presenting the systems portion. So today we're lucky to be able to have an integrated policy and systems training, which is pretty exciting. Um, and so they're both here going to present. And as always, this training will be recorded. We will have the PowerPoint slide deck as well as the recording available to you all on the Google Drive. So because this has systems elements, there is a factor of proprietary information and screenshots. So it'll be available in our Google Drive that you use probably almost every day. So it will be available there probably by next week or the week after. We need a couple weeks to make sure everything is ADA compliant and accessible. We actually don't want you to use the chat. Use the Q&A instead of the chat. I'll be locking down the chat here in a moment. It just makes things more manageable for the meeting with hundreds of people, and then also it gives us it all comes out onto a Excel document that we can then take those questions and answers and collate them and keep track of information and what kind of questions you have to improve everything and or to get Q&A back to you all. Again, the slides will be available with that recording on the Google Drive. If you're listening by phone and you need to come off unmute, *6 and or *9 to raise your hand. We have closed captioning available. And if you need some ADA accommodations, we have HCPUF 504 ADA at state.co.us. Now, without further ado, I'm going to go ahead and hand it over to Sarah Geisler.
Thank you, Amanda. Thank you, everybody, for coming to the last Rapid Reintegration training for case managers. We started this on December 2nd, so on Tuesday, then we had one yesterday, and today is the final one. Again, I am Sarah Geisler, and I will be conducting most of the training here today, besides Victoria Lewis, which she'll be answering most of the questions in the Q&A if you have any questions, and then Brianna will also be doing a few of the slides here. Next slide, please. Today on our agenda, we are going to go over rapid reintegration, the purpose and updates, and then review the process, expectations for case managers, some nursing facility resources, and then we'll also follow up with questions at the end. And there we go. Let's start with the purpose of rapid reintegration. It is to support members transitioning into the community with a more expedited referral process. Members will be given the opportunity to make an educated choice about community living options and transition services at the time of the level of care for nursing facility. Next slide, please. Rapid reintegration is for anyone who is either in the community or in the hospital setting and receiving a level of care for nursing facility. If someone has already been admitted to the nursing facility, then rapid reintegration wouldn't be applicable, and individual and group in-reach will be able to meet those members. So this is only somebody that is either in the hospital or is in the community receiving that nursing facility level of care. Next slide, please. Thank you. Rapid reintegration will be triggered when a case manager asks the additional questions under the community living education section in the CCM. They will ask the individual if they are interested in learning about community living choices and if they currently reside in the community or in the hospital. We will go over how this process looks in the care and case management system. The next slide, I kind of have a flow chart here of what rapid reintegration would look like. First, rapid reintegration process is initiated when the individual expresses interest in returning to the community during the level of care assessment in the community living education section. If the member states they are interested in rapid reintegration, then the case manager will ask the rapid reintegration barrier questions in the CCM. At the end of the rapid reintegration barrier questions, CCM will notify the case managers to do one of three things. They'll either submit a transition escalation web form, also titled the Health First Colorado and Child Health Plan Plus grievance form, if they do not have Medicaid. So that first question you'll see in there, which Brianna will go over, will be if the member or if the individual has Medicaid. Also, they might make a referral to the Transition Coordination Agency for a rapid referral if they have high risk or barriers, which must occur within 2 days of that level of care. Or they might complete the rapid reintegration plan assessment if there are low barriers. Again, all of this would be notified in CCM once you complete the rapid reintegration question barriers. Note, if the case manager does a rapid reintegration plan assessment, then we recommend the case manager to confirm and or submit additional referrals once the member has been admitted to the nursing facility, if the member was wanting home and community-based services, or the program for the all-inclusive care for the elderly, also known as PACE. The case manager will need to communicate with the social worker involved at the nursing facility throughout the process, and also will need to make sure they keep the rapid reintegration plan assessment up to date and also with the expected discharge date. And then finally, the rapid reintegration will be considered completed once the member resides in the community and receives a post-rapid reintegration satisfaction survey within 90 days of discharge. Or if the member decides that they want to stay in the nursing facility, then the case manager will add that information in the rapid reintegration plan assessment under comments, and also add an activity log in the CCM, stating why rapid reintegration was closed. Next slide, please. I'm just going to go over a couple of the barrier questions. Actually, this is quite a few of the barrier questions. These are just the examples of what you'll see in the CCM when you pull up that barrier questionnaire that I was talking about. 1, does the individual have Medicaid? Do they have HCBS? Are they expected to discharge from the nursing facility within 30 days? Do they have any complex health needs such as mental health issues? Do they have appropriate housing? Do they have a need for in-home care services, or do they have a need for home modifications? These are a few of the questions that you'll see in that rapid reintegration plan barrier questions. Now, based on the member score of the barrier questions, if it's a 0 to 6, then in CCM, it will indicate for the case manager to start the rapid reintegration plan assessment. And if it is a score of a 7 or higher, it will indicate to send a referral to a Transition Coordination Agency. And again, if the member or if the individual does not have Medicaid, then this is when CCM would stop the barrier questions and notify the case manager to send in a transition escalation web form. And then the InReach team will follow up with what steps to take. Next slide, please. For rapid reintegration, case managers are expected to submit a transition escalation web form when needed. For example, when the individual does not have Medicaid, please submit the escalation form within 2 days from completing the level of care. For another instance would be if a member was originally thought to discharge within 30 days when you did the rapid reintegration plan assessment, but is now taken longer than originally planned. please make sure that you add rapid reintegration when describing the issue. For example, rapid reintegration county escalation, or rapid reintegration unable to transition within 30 days. Also, the case manager will need to coordinate with the RAISE or other agencies like PACE as needed. Then, if the member has scored a 7 or higher on the rapid reintegration barrier questions, you might have, for example, they might have housing issues or expect it to take longer than the 30 days when initially admitted, then this needs additional support, and the case manager will send that referral to the TCA, as Brianna's slides had shown. If they score the 6 or below, the case manager will complete the rapid reintegration plan assessment, which will need to be edited as needed to keep it up to date and the discharge date current. The case manager will also need to reach out to the nursing facility after the member has been admitted to the nursing facility to confirm the discharge is reasonable within 30 days of admission. And then they'll make any other additional referrals needed. For example, for PACE or HCBS, you can confirm that with the nursing facility if they end up sending them in. And then the last step would be rapid reintegration is to complete the post-rapid reintegration survey within 90 days of discharge from the nursing facility. Next slide, please. We also want to go over some helpful nursing facility resources. First one is home maintenance allowance, or HMA. It is an adjustment to patient liability for Health First Colorado recipients in a nursing facility that will be returning home within 6 months. Home maintenance allowance is based on actual and verified shelter expenses, such as mortgage payments, taxes, and utilities. It will be calculated based on the verified expenses, and the result will be communicated with the skilled nursing facility on the 5615 as a part of the patient payment. Eligibility workers, skilled nursing facilities, billing staff members, and anyone assisting the members should coordinate as much as possible through any means that are reasonable, email or mail, fax, etc., in order to secure the verifications necessary to calculate the home maintenance allowance. Case managers should consider this program for anyone already in the nursing facility or one that might be in a nursing facility for longer than 30 days and they are interested in returning back to the community. We have created a home maintenance allowance quick reference and also a physician's form that needs to be filled out for home maintenance allowance. Both of these are available on the Transition Services website. Next slide, please. Another resource we have is Targeted Case Management Transition Coordination, TCMTC. This benefit is for members wishing to transition from a nursing facility setting and back into the community. The TCMTC will conduct a comprehensive assessment for transitioning, a community risk assessment. They will develop a transition plan, a referral, and monitoring follow-up activities. Examples for services that TCMTC can complete are housing vouchers, coordinating any medication or durable medical equipment needs with the nursing facility prior to discharge to ensure that the components of the transition plan are in place. They will also communicate with HCBS case managers, rate coordinators regarding any services or delivery or any concerns. Next slide, please. Let's review the training a little bit. For community living education, the case managers need to inform members of other programs and services that remain or return to the community. Rapid reintegration will be for anyone that is interested in transitioning back to the community from a nursing facility and is currently residing either in the hospital or in the community. Then just a reminder that if an indefinite length of stay is given, it states in CCM that the service options were discussed with the member under the length of stay form. Next slide, please. Expectations for the case managers. By January 1st of 2026, the expectations is for the case managers is to complete all CCM trainings as well as that web-based training that we have in the system. Be familiar with other programs such as HCBS, Long-Term Home Health, and the PACE program, and also know other resources like Home Maintenance Allowance and TCM/TC services. Also make referrals to TCAs within 2 business days if there is a score of a 7 or higher on the Rapid Reintegration Barrier Assessment. And if there are any issues throughout the rapid reintegration process, then send in a transition escalation form via the web form, also known as the Health First Colorado and Child Health Plan Plus grievance form. For example, if the individual does not have Medicaid or if the member was planning to discharge within 30 days and the rapid reintegration plan assessment was done and there's something holding up the transition, make sure to include on the escalation form rapid reintegration when describing the issue. Also, as case managers, I'm sure you know, document, document, document within the CCM and also in rapid reintegration sections or the activity logs to make sure you keep everything up to date. For example, if the member changes their mind and decides that they want to stay in the nursing facility, or if the county hasn't approved the case, make sure you document everything in here so we see where the status is at for rapid reintegration. And last, case managers should understand the process and reference to the job aids available in the Google Drive in CCM. Next slide, please. So this is where we get to have some fun with our React buttons. We are going to do a check to see how much you have learned about rapid reintegration in the process. Please select the icon that would best answer the question. The first question is, what criteria must be met to follow the rapid reintegration process? Please select the best response. The thumbs up for the individual has Medicaid. A heart for the individual is being assessed for HCBS, or a flame for the individual expresses interest in returning to the community, has Medicaid, and is being assessed for nursing facility. Thanks, guys. Next slide, please. You'll see it is the flame. If the individual expresses interest in returning to the community, has Medicaid, and is being assessed for nursing facility. The individual, if they are being assessed for HCBS, then Community Living Education section in CCM will not appear. Next slide, please. A couple more we have here. What would you do when an individual is being initially assessed for nursing facility placement and does not have Medicaid? Thumbs up for nothing, a heart for submit a transition escalation form, or a flame to send in a referral to a transition coordination agency. Oh, I love seeing all the hearts. Good job, guys. Next slide. If you selected the heart, you're correct. If the individual does not have Medicaid, the barrier questions would stop and CCM will indicate a transition escalation form needs to be submitted. And we have one last one. If the rapid reintegration plan barrier questions in CCM indicates the member scored a 7, what would the next step be? A thumbs up for submit a referral to the transition coordination agency, a heart for complete a transition escalation form, or a flame to complete the rapid reintegration plan assessment. There we go. Thumbs up. Correct. Make a referral to the transition coordination agency. A rapid reintegration plan would only be done if the score was indicated in CCM to be a 6 or below. Okay, next slide, please. Here are some resources available from this training: the LTSS Member Preference Guide, the Rapid Reintegration webpage, which includes a Rapid Reintegration Q&A, the Rapid Reintegration Operational Memo. The web-based training is in CoLearn, as well as all the job aids will be in your case management agency Google Drive. And also on the website is the Home Maintenance Allowance Quick Reference and the Transition Escalation Form, which I think Amanda is adding into the chat. Next slide, please. You'll see the job aids here that will be in your case management agency Google Drive. These include the InReach level of care and rapid reintegration checklist, the rapid reintegration plan assessment, the rapid reintegration plan barrier questions, and creating a referral to TCA, and also the post rapid reintegration satisfaction survey, and then the rapid reintegration video walkthrough. Now we'll go ahead and at the next slide, and please don't drop off yet. We do have some information right after our questions. A question, if you guys have any questions, please go ahead, and if you haven't been putting them in the Q&A or raise your hand, we can take you off. One question might be, is there some areas that do not have TCAs? What would the case managers end up doing? You still go ahead and submit a TCA, and when you leave it blank, then the department is actually going to follow up on it. We actually get notified when there hasn't been an assigned TCA. So you can go ahead and still send those in for those areas that do not have a TCA assigned to them, and then the department will end up following up on that side. So I don't know, Victoria, if there's any questions in there, or if anybody else has any questions, to go ahead and come off mute or raise your hand, and we can have you ask the question. And then we have just a few more slides for you guys afterwards, if anything has come up, and then we'll also share some different office hours that we'll have and stuff.
One question in the chat, I'll just let you answer it live. Which case manager is responsible for completing the post rapid reintegration survey, intake, or ongoing?
Actually, it doesn't even have to be a case manager, even though it says a contact. It just needs to be done 90 days after, and it would be notified to the case management agency. So even with those post-rapid reintegration survey questions, it might be a case that actually was sent to the transition coordination agency. So you might not even know when they are back into the community, since it didn't have a rapid reintegration plan assessment. So this might be even coming from a different agency, say for if the member was in a nursing facility in one county, ended up transferring and going back home in a different county, and a different case management agency might be receiving it. Then it will be actually when the case management supervisors end up pulling reports, they would be notified that that post-rapid reintegration survey would need to be done. Now, it'll depend on how the case management agency wants to operationalize it. If they want a admin to go ahead and ask the survey questions, or if it's going to be the ongoing, can go ahead and ask them at their next contact. These are services that would be getting paid to do the post-rapid reintegration satisfaction survey. It looks like the home maintenance allowance form is being added in the chat also.
I did add it to the chat just because I don't know, I couldn't click on the other one that Amanda put, but I wanted to just, in regards to the home maintenance allowance, somebody had a question, so I just want to make sure that I answered it correctly. But if you can kind of talk about it a little bit more, Sarah. They said case managers have to fill out the home maintenance allowance. So they're asking that question. And I put a response in, but if you can kind of just go over that a little bit more.
Yes, case managers, our goal is to actually just make sure that case managers are aware of this program that is available for individuals that are going into nursing facilities for short-term stays, that they are planning on discharging within, I think I had that within 6 months there. I think it was 6 months. If this is something that when you ask or when you let the member know, this is where we want to make sure that it is communicated with the nursing facility for the 5615, and also then that physician's form, and also there is a quick reference. So just to be aware, to go ahead and let them know, and then also let the nursing facilities know that this is something that the member is interested in. So it doesn't mean that you're actually filling out the forms. If you do have the forms, if this is something that you're actually at the hospital and you are able to go ahead and get that doctor to go ahead and sign, or you can leave it with the social worker there to get him to have him sign it. This is everything that needs to be sent in for that 5615 by the nursing facility to get it to the county to make sure then that that member would be eligible for them.
Victoria, are there any questions that were asked that you feel would be pertinent to have Sarah answer out loud for everybody?
Surprisingly, there's not a lot of questions in here. um, we already answered about TCA. That was one of the questions somebody had about the count, in Southwest Colorado about there not being TCA. So, like Sarah said, still send the TCA referral. And currently, what's happening now is a TC administrator will outreach other nearby TCs and see who is willing to accept the case. Sometimes they'll still do a face-to-face, depending on how far it is, or they'll do virtual meetings just to accommodate those. And then I went ahead and added the TCA list that has the counties they serve in the chat or in the Q&A.
Perfect. And
That's it.
if I just want to let everybody know, if you want to come off mute, we can allow you to come off mute. If you want to raise your hand, just use your raise hand button and you can ask a question verbally if you prefer not to type it. Thank you,
Have
Victoria.
many, Amanda. You can always go to the next thing and then we can come back to questions also. I'll go over the office hours.
Yeah.
There we go. You'll see we are going to have office hours after this is implemented. So obviously January 1st we don't work, but we're saying it's effective. Rapid reintegration will be effective January 1st. So after that, you'd want to go ahead. You'll see that additional question if the member is interested in rapid reintegration on that community living education section. And then it's January 2nd is actually a Friday. So I'm not expecting there'll be a ton of them that will be coming through, but we will be having our first office hours on that January 6th, which is Tuesday. If anything comes up, if there's any questions, if something's not working, if you're not understanding something, definitely please join in on January 6th. Amanda will probably be adding the link in here at 9 o'clock. Then you'll also see we wait until the week after. We'll do one on January 14th at 1 o'clock, and then we'll have one on January 28th at 9 a.m. And then if you want to go one more slide, you'll actually see our contact information. Here I'm the contact. Here's my email. Victoria Lewis also that has been answering quite a few of those questions. So we'll be taking over rapid reintegration. About after the first, I'll be here for support. Chanel Pugh is our supervisor. Her information is also on here. And then you'll see our general inbox, HICPUF, HCPF _CLO _inreach at state.co.us. And then we also do have an InReach team project feedback form. So any of the InReach team projects that we have been working on, you'll see you can definitely add in and use this multiple times for any feedback that you might have, or if any questions that you might have. I know in regards to the DOJ settlement, a lot of our InReach team projects have to deal with. So if anything comes up, or if you're not understanding anything, or if you have any feedback, please send in that form to us also. And then I'll open it up again for questions. Again, just so you kind of are aware, what we're trying to do with rapid reintegration, the goal is just to head off and get members or individuals, if they are interested in returning back to the community, to get them started in thinking on how we can get them transitioned out to the community sooner than later. Beforehand, it was always done after they've been admitted into the nursing facility, which will still go ahead and happen with individual InReach and also group InReach. But now we're trying to go ahead and capture those individuals that are either in the hospital or also in the community that are going back in or receiving that nursing facility level of care. So we're trying to go ahead and capture them prior to, and then that's why the barrier questions are actually going to slim them out. And if they do have any barriers, if they're needing any home modifications, anything that's going to take that more than 30 days or that needs a lot of support, if they don't have housing, all of those are going to get referred to Transition Coordination Agency. And this is when we'll also follow up with the TCAs to make sure how it's going. If they're needing any support, they also have an escalation that they can reach out to us also. And then at the end, that post-rapid reintegration satisfaction surveys, just so we can understand where we can improve, what we can do to make things better, if it was how they were planning and if they were able to get their needs met. So any questions in regards to anything that I've mentioned recently? Again, if you guys have any questions, feel free to reach out to us. You have my email. Otherwise, if there isn't anything in the Q&A or if there's
Well,
no questions, hands up, go ahead.
we did get a couple questions that maybe you want to just speak to a little bit. If someone goes in for Medicare days under Medicare and then a referral comes in, we're getting that
Yeah.
question. So if you want to speak
Yeah,
to that a
so
little
this
bit.
again, if they go in and you did not receive that referral or the for nursing facility level of care while they were in the hospital and they've already been admitted into that nursing facility for that rehab stay, then that would be when you choose an A on that community living education and want to ask them if they're interested in rapid reintegration. So it would not be applicable to them because they would be already been admitted into that nursing facility. They're just receiving that pay source change, but they've already been in that nursing facility. So this is only for a member that is receiving that nursing facility pay source change or the level of care, and they are currently residing at the hospital or in that community. So that would wean out half of those also that are just going in for rehab stays.
Thank you.
There was another question. I must have missed it. I'm going up looking. When you were talking about the post-rapid reintegration survey, somebody else asked after you responded, does this mean a case aide would complete these surveys?
Could mean a case aide or admin could complete the survey questions.
It looks like Amanda
yeah,
also
maybe.
posted the home maintenance allowance, the link again. It's also in the chat too.
We might want to double check I'd be curious to know what error you guys are getting for that. I wonder if it's an access issue because it's shared via the Google Drive.
It should be on the website on the transition escalation page. I know I had it up earlier.
Yeah, and the link is working for me and obviously Victoria and you, but if someone external is not able to access it, it might be an access issue.
They're saying it says page not found error.
Oh, okay.
Okay, thank you so much for letting us know. We're gonna have to take that back and see what's going
I
on.
had it pulled up. And I think there was somebody else that actually had a question.
Oh, so I guess some people are able to access it.
I thought someone had their hand raised, or maybe they were high-fiving me.
Yeah, we have, let me see, that is Megan McWilliams. I'm going to allow you to talk.
Oh, there she is. Go ahead, Megan.
Hi, can you hear me?
I can.
Perfect. I just had a quick follow-up for the post survey. I was the one that asked about if a case aide could complete the survey. I just want to clarify that the person does not have to have the case management qualifications to do this.
Oh,
So it could be an admin, a case aide, or anyone else, kind of.
correct.
Yeah. Thank you.
Uh-huh. Any other questions? If anything comes up, again, make sure you reach out to us or provide us information on the feedback form in regards to the survey, or you can reach out to me directly. Otherwise, thank you very much for attending. This was our last one that we had. If anything comes up, you'll probably end up seeing that additional question. December 18th is when it's supposed to go live. Again, after December 18th, just put in A. It's not going to be in effect until January 1st. Then after January 1st is when you'd start asking those rapid reintegration questions and start doing those barrier questions only if the member is in the hospital or in the community and receiving that nurse and facility level of care. Otherwise, we'll give some time back to you. We'll stay on for a little bit if any questions do come up. Cheers to you too. Thank you. Go ahead. That's like kind of like a happy new year and happy holidays. If you have any other questions, feel free to stay on. But also we'll give you some time back to you and you can go ahead and drop off. We'll also try to put together a Q&A that we've had from all three of these sessions. I do have a Q&A listed from before when we met with the case management quarterly meeting and had some questions. So that is posted on our website also, which I think that website was also entered underneath the chat area. Otherwise, everybody have a great day. We'll stay on for just a little bit as people start dropping off. If you want to come off mute or ask any other questions in the Q&A. Thanks so much, guys.
Yep, we'll hang out for 5 minutes from questions. So if we don't get any questions in the next 5 minutes, we'll go ahead and end the meeting for everyone. But if you do have questions, please don't be shy. Feel free to ask them. Great work, Sarah.
Thank you. Thank you, everybody.
Anna. And welcome, Carly. Oh, we got it. We have another question from Heather King. Are there concerns about demographic availability of services or service deliveries? So I think this has to do with like rural community.
Yes, I think with the rural communities, this is definitely, of course, a concern. This is when we'd actually like to see the escalation form. If this is something that they have gone through and we think that we could get them out within 30 days, but there is a problem with getting services in those rural areas, please send in an escalation ticket as soon as possible so we can also start working on this side of things to see if we can get them transferred within or transitioned within that 30 days. If not, and it ends up being longer than that 30 days, then we still want that escalation ticket sent in so we can kind of see where we're getting stopped at in those areas.
Great question. Thank you.
Yes. Always want to help out in those rural areas and see how we can all put our brains together.
Yeah, yeah. Okay. Oh, yeah, you can totally unmute. Let me find you, Heather, and I will get you unmuted. Okay, you should be able to unmute yourself now. There we go.
Hi, Heather.
Hello, thank you. Sorry, it's very easy, more easy than typing.
What's your question today?
How about our unhoused community with this?
Unhoused community? Are you talking about trying to transition them back if they don't have housing?
Yeah.
Okay.
I have a lot of members who are unhoused and do rely on our shelter programs here locally. And oftentimes they are admitted to the hospitals, then to the rehabilitation centers, and then often released back to a shelter situation.
Mm-hmm. So this is going to be, if they're just going into the nursing facility under rehab and they don't receive that nursing facility level of care at the hospital, then that would go ahead and individual inReach is going to capture those people and start with that transitioning services after they've been admitted. Now, if it's someone that actually does get a referral sent in from the nursing facility and that rapid reintegration does start, but they do not have housing, then this is when the case manager is going to go ahead and send in that that a TCA referral so that TCA can start working with them, because that does take longer than 30 days to find housing for supports and for services so they can remain in the community. So that would be when either of those situations, if that does come up, we either want to get them to a TCA, or if they already are in the nursing facility, this is when individual inReach will capture them in the nursing facility within 6 months from being admitted.
Perfect. I actually just had one of those situations. That's great. Thank you for explaining.
No worries. Thank you for asking, Heather.
Of course.
Heather,
If
this is
anything else, comes
Victoria.
up. Yeah.
I was just going to add to that a little bit. So currently, right now, the department has been working with DOLA to secure additional housing vouchers, for these specific populations and our projects that we're working with. And I understand that, sometimes too in the rural areas, even finding those housing can be challenging. Sometimes I know they've worked with the TCAs have worked with members to see if they're willing to move, relocate maybe somewhere else where there is housing available. But that is definitely on our radar, is to, and that's kind of why we started these DOJ projects, is that we're trying to avoid where members are being admitted to nursing facility because they're unhoused, or because they're not being discharged because they have nowhere to go afterwards safely. So definitely, like Sarah said, send in that TCA referral, and the department's working with DOLA to obtain additional housing vouchers.
I think it sounds great.
Thank you, Heather.
Right. We are at 9:55.
Looks like we still have a couple people on. If there's any other questions, please go ahead and ask. Otherwise, you're able to go ahead and start dropping off, and we'll give you some time back.